Hey y'all, welcome to another edition of Compliance Capers. I am here with my good friend and colleague, Sonal Patel, as we want to talk about another self-disclosure in our April showers of self-disclosures of telling on ourselves thing. So how you doing, Sonal?
I'm doing great, Betty. Yeah, definitely has been a lot of rain here in the Chicagoland area. So yeah, April is definitely here. I'm looking to those flowers eventually come up.
Yes.
It's just been a soggy mess, but yeah, I love this month of our self-disclosures. So yeah, I'm excited for your topics and all the items that you've been pulling for us from week to week. So yeah, it's exciting. It's exciting stuff.
Good. Yes, and we're going through with our compliance capers, which we've been doing now since January of this year. It's kind of hard to believe this is our fourth month already
Yeah.
of doing these. So,
Yeah.
we're trying to take a look at different things that are out there that practices have either kind of gotten in a little hot water for doing, or have noticed that they were doing that they shouldn't have been doing, and kind of like this month, fessed up about it so that we can discuss it in ways to help other practices not do the same thing. Or if you find you are doing the same thing, to make sure you stop it. So
Exactly.
we're trying to do our part in helping the medical practices all stay compliant. So today we are going to talk about some self-disclosures, and I believe we found 4 of them that talk about things that they probably didn't think twice about kind of doing, thinking they were either good services or good turns to kind of do for one another. But in our field in healthcare, they don't quite like that so much. So we're talking about giving out.
Remunerations.
Thank you.
Mhm.
That is one of my stinky words. I can't say it. It never comes out right. I get the M and the N. It always
I
turns
know.
in,
It's a
it's like
tough one.
renumer, I start, yeah. So
Yep.
still not as bad as just when I try to say that.
That's another bad
So,
one. Yeah,
yes,
that's a
that
terrible
one.
word.
But at
Yes.
least I can say permanent.
Yeah,
So,
see, I don't even get me started. I can't even. I just go straight hair is better than permanent hair. I just say it. I just said it. I just said it today.
See, you got to do it
Wow.
fast without thinking.
On to
That's what
that.
it is.
Yes, and I wasn't even thinking. That's absolutely
Yeah.
correct. I should write down today's date. That's when I first said it. Amazing. Amazing.
Like the first time you say spaghetti
Yeah.
instead of biscotti,
And biscotti. Exactly. Exactly right. Oh my goodness.
Okay, one of our
Hysterical.
tangents again. So
Our squirrel moments. Sorry.
no, it doesn't take much for you and I when we're
It
doing
doesn't.
something.
Well, we always have
But
fun. We always have fun, even though this
yes,
is a self-disclosure kind of a scary month.
yes,
We still like to,
yes.
just have a little bit of fun in here. Yeah.
Of course. So, and as y'all are watching, if you have those sticky words, feel free to share them.
Yeah, share,
We'll
please.
discuss. That's what we're here for.
We
Yes.
cannot be the only 2 people who have our trouble words. Yeah. Yeah.
All right. So, but in the free services kind of issue or free
Yeah.
things that you try to do,
Yeah.
it can be looked at as enticement, right? So in our the OIG, here's a link for y'all. The OIG has some information about on a fraud and abuse kind of section in their web page, where they kind of just discuss different areas, of where things can become fraudulent, abusive behavior. And so if you go to this link, it gives a kind of listing of different things. Like it starts out and talks about the fraud and abuse laws, and they go through the 5 most important fraud and abuse laws. So if you go to the link, you can kind of see other things like the False Claims Act, the Anti-Kickback Statute, which is what's going to come into play with us today, the
Yeah.
Stark Law, the Physician Self-Referral Law. So it's a good one spot to be able to go and look at and see like the big hitters for fraud and abuse. So
Exactly.
that's why I shared this link. You could, search anti-kickback and find, some more specific ones that are just to that statute. But I like this one because it gives you that nice listing of, what they're always on the lookout for at the OIG. And one of the things when you look at the anti-kickback statute portion of it on that link, I thought both of us, Sonal and I, were talking a little bit about this, and I think it's interesting that in the portion for anti-kickback in bold, they have, in some industries, it's acceptable to reward those who refer business to you. However, in the federal healthcare programs, paying for referrals is a crime. So, they just flat out, they're like, I know people do it in other things and it's okay for them to do, but with what we do, it's a big no-no, right? So, what are your, kind of thoughts? I think that's where some of these practices get in trouble, because why isn't it okay? I mean, they do it for other things, but here in healthcare, it's, the big skull and crossbones, right?
Absolutely. Absolutely, Betty. And we were talking offline before we came on to Compliance Capers. And, you're absolutely correct. I think general people just think that healthcare can be treated the same, right? Like you do for other companies, other industries, right? But no, like it says in bold there in that anti-kickback statute paragraph on that link, it's right there. It says that that's a complete no-no, right? And a lot of the cases that we're going to go over with the audience today, like you alluded to earlier, these are things that these entities thought they could just do. They thought it was acceptable behavior. They didn't question it. But remember a couple months ago, we talked about the month of our advisory opinions in February, right? Like a lot of these instances could have either been researched before, was there an advisory opinion that was provided that may be perhaps applicable, right? Or could you yourself have perhaps filled out the application and asked for an opinion from the OIG? So, I mean, there's lots of other things in healthcare that are incredibly complicated, and it's best to kind of get your ducks in a row before you just start doing something, doing a service, providing a new technology, for example. Like, can I do this? Is this FDA approved yet? Right? So there's many, many of those types of questions I think that our providers at large should be thinking about before they start getting into this kind of work. Because here on Compliance Capers, we have disclosed to the audience over these many, many weeks, a lot of the really, detrimental findings that the OIG has made for so many specialties across the country. So it's just good food for thought to keep this link, these couple of pages here, as a tool in your toolbox, because these 5, laws our providers should know about, each and every one, and how they can be applicable to you. So
Yeah.
This was a good one. This was a great link. And I think everybody in this space should know what these 5 are. Absolutely.
Yes. And I think you got an excellent point there with saying, look at those advisory. I mean, that's why we're doing this, too. If you look at the advisory opinions and see, is there anything else out there already that matches kind of what we're thinking about doing, and giving away free stuff, or the illusion of that,
Right.
giving services for someone coming to you at no charge, anything like that should like make the hair on the back of your neck stand up, so look at those advisory opinions. And this would be an easy one. Call a healthcare attorney. It
Yeah.
wouldn't be like
Yeah.
a big long, it could be like a 5-minute conversation. Or if you have, counsel, compliance officers where you're working, if you're a larger facility, take these kind of things. If somebody gets, a great idea, run it past compliance first, run it by a healthcare attorney first, call, an outside consultant like myself, to say, hey, we're thinking about doing XYZ, what do you think? We can lead you to certain things to say, probably not the greatest idea, or we can't find anything that says that, there would be a problem with that. We're going to give you a thumbs up, and, y'all can go, full bore on whatever your ideas are. But definitely, I think, doing that quick little check, because when you look also at that link, when you go to that section that talks about the anti-kickback, I'll read it with the things that can come out of you kind of flushing up against the anti-kickback statutes. It says that that you can have the criminal penalties and administrative sanctions, including fines, jail terms, and exclusion from participation in the federal healthcare programs. So just think about that. How many of y'all could do something like that and get excluded from Medicare and still keep your doors open? There are some practices that maybe aren't real heavy in Medicare, but most practices, unless you're pediatrics or some kind of specialty area where you don't choose to see a lot of Medicare patients, that could really, cause you to not be able to, survive it. And then the civil monetary penalties could be $50,000 per kickback, plus treble damages for the
remuneration. Remuneration. Yeah. 3 times.
Yep.
3 times. That's, yeah.
So it's
numbers,
not just give it back. It's give it back plus, like
plus,
way back, right?
Plus way. Yes. Yes. That's why the monies are just huge when you hear about these kinds of cases, right? The volume is in the millions, again, because more than likely it can be that high because of these additional penalties and fines that are tacked on based on these various regulations. Wow. Yeah, that's a big number for the AKS.
I was just like, ooh. And it also, points out too, in another bolded statement on this, is that as a physician, you are an attractive target for kickback schemes. So they're also putting out there that, you really have to watch your back, because you can be a source of referrals for fellow physicians or other healthcare providers and suppliers, because it's the physician, when you think about it, or the APP, that's driving those things. They give them the script. They give them the referral over to PT or OT or to whatever lab or for whatever diagnostic service, so if you have someone approaching you, a business that says, hey, for every patient you send us, we'll give you, anytime you get that kind of, you do X and we'll do this for you, scratch my back, I'll scratch yours kind of thing.
No.
You should really be kind of like, yeah, okay, I think I'm going to back off from that one, because you don't want to get caught up in that. And a lot of the fraud that we see will be where, like DME, huge, right, for Medicare fraud. And most of the time when you find that, because to get DME, you have to have a physician order or an APP. You have to have an order. So a lot of these schemes involve the DME companies and some physician group or some APP group or some one physician, a couple of them, that they're paying for every script they give them or every patient they send over to them for their DME. You always see that tied together, almost always. When I'm looking at these for the DME stuff, it's always tied in with somebody getting kickbacks for what they're doing. So it is, I don't want to say rampant to make it seem like everybody's on the take, but you do see it heavily in certain areas. And so if you're involved in like DME or lab stuff, like with the genetic testing and things like that, we always see too, a lot of kickback stuff that goes on. So as the practice, as the physician or APP, y'all are kind of like the gatekeeper for that, because if you're not doing it, it's not going to be driven back to you. But with some of the ones we're talking about today, it's even on a bigger scale, as like the system had decided, hey, if
Yes.
these people will come here, we'll do these services for them, and now back in the day, I remember that was perfectly fine. I was at a physician practice. It was in the 80s. It was before the anti-kickback stuff actually had come out. And then when it did, the practice that I was managing, we had to renegotiate our contracts with the health system, because we were one of those practices. This practice had the people in the office were employees of the hospital system, and then the practice paid them for them. And then the practice paid for the space we used, for the office, because they were owned by the health system. And before the anti-kickback statutes came out, they gave us a deal on our office space. If you are part of our healthcare system, doing this contract with us, and you're sending your patients to our hospital, we'll not give you the space because they didn't think that was right, but we'll let you rent it at a discounted fee per square foot and blah. So when the anti-kickback stuff came out, all of that stuff had to be redone because we couldn't accept it anymore, and they couldn't offer it because we didn't want to get in trouble. Yeah, and that's when, for those of y'all that remember too, all the free lunches,
Yes,
all
those
the
days are
free
gone.
stuff
Yes.
that the drug reps brought, all of that stuff had to stop when this stuff came out. And that was, boy, that was great time working in the practices that I tell you, never had to buy lunch. And, a lot of times we'd even have breakfast. Somebody would bring breakfast into the practice, and you didn't have to buy a pen, or you didn't have to buy Post-it notes, and you didn't. We had everything, but yes. So, looking at, now we'll pull up some of I did again, like last time, because of the links for these self-disclosure things are so incredibly long. I just made a PowerPoint little slide to pull up, and what we'll do, we will cut and paste all of the links inside of LinkedIn, so that all of y'all can be able to go get them that way. Because I know sometimes, you're trying to get all this stuff down. So I don't want everybody having to write down like a maniac. So we'll put them all in the chat in the LinkedIn thing, so y'all will have these. So Sonal, you want to kind of run down, and as you look through these, you can see that, some of them are pretty heavy hitting amounts that they're paying back in these self-disclosures for this stuff, into the millions. The lowest one is that last one that was $100,000, which is still not chicken feed. But, they can add up pretty quickly. But just think about that in that 50,000 per thing plus treble, what it could be. Yes. So that's where the self-disclosure comes in handy, because then none of that stuff applies. And, you just are able to go back and remember that someone last time on, or the first one we did for the month, was talking about how they will go down to, if you do need to be penalized, it would be at 1.5 times versus, the treble plus that they could do. So some of these, they may have been fined a little bit, but not like they could have been, right?
Exactly right. So yeah, I think you pulled some really good examples here for things that these folks got into a lot of hot water for. But good thing they self-disclosed, right? So, the first one there for Ascension, Christie Hospitals in Wichita. I don't know if that's Kansas, Wichita, but they've agreed to pay $3 million for allegedly violating the civil monetary penalties law, so our CMP law, by paying remuneration in the form of free services, right? And again, the blurb of information when you do pull on that first link eventually when you guys take the time and do that. Basically, the only other information that it states is that the OIG alleged that Christie Hospitals, Wichita, paid remuneration to organ transplant physicians, trauma physicians, orthopedic physicians, and cardiovascular physicians in the form of free advanced practice provider services. So, that's what they were doing in terms of free services. So free provider services, right? And I just told you the list of specialty providers that they were doing this with. And so to me, this was a case that I hadn't really come across too often in my experience. Like, I don't really ever hear of something like that being done. So yeah, when I read that, I was kind of like, wow. And they did that for free. And I don't know if they, had a legal team at the hospital. I presume they do have an entire, arm of attorneys that are there for them. And, was this walked by them in the beginning as they were, thinking perhaps they should do this? We really don't know. But, it's interesting that they thought they could do this.
Yeah. And it's a recent one too. This is from February of this year.
Yeah.
So, I mean, it's not like it's one from 3 years ago or 4 years where you could, kind of maybe get like, oh, they kind of didn't know better or, but yeah. So they definitely did not, phone a friend and ask the right questions.
Phone a friend. Yes. Like, please. Yeah. That's why we always implore everybody here. We need to find our trusted healthcare attorneys, please. We know lots if anybody needs assistance, if you don't have one. Always consider using their sound legal advice before you make these kinds of weird thoughts that actually take hold. And then this piece of paper was issued February 26th, like you said. So just a short time ago. Wow. So the next case there is for Advocare, who's agreed to pay $2.2 million for allegedly violating the CMP, again, law by paying remuneration in the form of bonus payments. So they're the ones that didn't do free, but they did bonus payments, right? So interesting. Let me pull up that document as well. So the other small highlights there in the paragraph on that document for the self-disclosure, the OIG alleged that Advocare paid remuneration to a non-member physician in the form of bonus payments that corresponded to certain outpatient drugs and durable medical equipment ordered by that non-member physician that were outside the scope of his employment.
So the bonus thing doesn't necessarily, so don't freak out because your physicians and APPs are getting bonuses. It's not, I think the important part in that is that it was a non-member physician. So it was outside of what the group
outside
was.
Of the scope. Right. Exactly.
And then outside of the scope of the employment agreement. So it was just like, well, you're not part as a member, to where you can get in the regular bonus program that the other doctors and APPs are in. But if you give us these orders and these referrals.
Yes, for these outpatient drugs and this DME types of products. Right. Exactly. So again,
that I think is where they kind of cross the line.
They cross the line. Yeah.
But look at that. It made me it just now hit me. It's for one non-member.
One non-member.
2.2 million
for one
person.
One person. Oh. Right. See? It's unbelievable. It's unbelievable.
Yeah, it didn't hit me before. I was just like, man, that's for one for
Yes,
one
for
guy for
one
having a baby.
person.
I bet they're glad they didn't have a bunch of non-member physicians at that point, because as you can
Exactly.
imagine, that would definitely hurt them a little bit.
For
Um,
sure.
but
For
yeah,
sure.
yeah. So it's that enticement issue. You know, that's what you want to
Exactly.
be thinking when you are considering these types of things, or if y'all are doing enticing kind of things, or
Mhm.
bonus, or giving free services or things
Research.
to
Mhm.
patients or other
Mhm.
vendors. Think about that enticement factor, like what are you getting out of it, to
Right.
kind of see if you might be crossing the line. These days I really, I must tell you, I was really kind of surprised that we see so many of these days, that's not, the fraud ones are one thing. They're
Yeah.
purposely trying to rig everything and get stuff they don't deserve. That's one thing. You're
Mhm.
always going to have those bad apples that are trying to get something for nothing. But for the self-disclosures, I was kind of surprised, to be honest with you, that in 2024,
Mhm.
we're having
Mhm.
these, that they're like, oh, we
Yes.
didn't realize we, couldn't give this stuff away for free and get that.
Right.
It is like everywhere. It's all everybody talks about, but we do still see it. And that's why we wanted to talk about it here today. And I don't mean, if you find that y'all are doing something like that, we're not trying to, say that anybody, yeah, or more, I'm not trying to belittle or, anything like that to anybody. It's just,
Yeah.
really make sure that you're looking at everything, and
Mhm.
make sure that if you're talking to people, they're people that are seasoned healthcare professionals. Because
Yes.
something like this, if it's a newer person, they may say, well, hey, at my salon, or hey, these businesses, they all
Right.
do this stuff all the time. Well,
Mhm.
I'm sure
Mhm.
we could do it, and they don't take that extra step. And so that's, as someone had put it, trusted healthcare advisors, trusted
Mhm.
healthcare consultants, healthcare attorneys. Make sure you're going to somebody that has been around a little bit, and has seen these things. I mean, we were in before these things were laws, so
Right.
that's our tenure, in, and for things like this that could end up costing a practice millions of dollars, you want to make sure you're checking on thoroughly. So then we have Sutter Health next, Sonal.
Yeah, we have the next one, Sutter Health. I was shocked at this one too. Agreed to pay 515,000 for allegedly violating the CMP laws again by paying remuneration in the form of free management and administrative services. So let me pull that one up and see what else I can talk
Yeah,
about
I
in
think
this
with that one, that's
small.
all that's in there. They really
That's
don't
all
go
that's in
into
there.
anything else. Yeah,
They
but
paid remuneration to a surgery center. It was a surgery
oh,
center that
it
they
didn't say
paid.
surgery center before? Okay, yeah, yeah. So yeah,
Sur
anytime somebody's wanting to
Yeah.
give you something of value for free, for you to do something for them, or to join them, or
Yeah.
to send patients to them,
Mhm.
you're going to be bucking up against the anti-kickback stuff and getting into the civil monetary penalty arena.
Yep.
So that's what you kind of want to look for too. I mean, if the enticement is, I'll take you out to lunch, that's not really, unless it's I'll take your entire practice, all the physicians, all their families, all their whatever, and we're going to
Right.
cater this big to do that's going to, cost me tens of thousands of dollars. Now that's a different story, so
Mhm.
you have to look what the value is. And I know some on the, for the CMPs and the anti-kickback, they do have those dollar values on things where you can accept, like, remember we used to do the baskets too at Christmas time. So
That's
we would
right.
send gifts. Everybody that referred to you would send
That's
you a
right.
gift. You'd send them gifts, and and that all had to stop unless it was
Correct.
under a specific dollar amount. So you can do
Exactly.
small things, but not
Exactly. It
anything
has to be
of
small.
any value.
Exactly right. I think it's like under $25. It has to be
Yeah.
something like very,
Yeah.
very
Like
small.
very low. Yeah.
So we have to be very careful at Christmas time, at birthday times. Those old days are beautiful, but they're in the past. We really cannot give gifts of great, great value, like that very expensive bottle of, I don't know, some wine from France, that costs like $500. You just
Yeah.
can't do that. You just
Yeah.
can't do that. I
Or
always have thought,
tickets.
or tickets to basketball
That was a big
games,
one.
go see the Nuggets or whoever, or the Cavs in Cleveland. No, like you just can't do that. Um, yeah, I was telling someone the other day that, even if you're providing lunches for your staff, of course it's a great thing, right? But when these big pharma reps come and peddle their wares, which we need
Yes.
good antibiotics, we need supplies, absolutely. However, they need to be doing so and provide their lunches with education, right? It has to be something of, educational value that the providers can take away. You cannot just serve them lunch for like 2 to 3 hours and just leave, your packet of samples of your injectables or products, whatever. You cannot just leave. You must provide at least an hour of good education, that the APPs, the MDs, the staff, the coders that are on staff, people can take away that education, as well as, have a good meal during
Yeah.
the lunch break. But I mean, yeah, the old days are gone. And all of those fraud, waste, and abuse laws take effect, and they really do outline the nitty gritty in that document. And so you really have to be aware of what you're playing with, right? If you want to play outside the lines, you have to be aware of the risks that you're taking. If you don't want to do the right thing and, ask the OIG for their advisory opinion, if you don't want to talk to your attorneys and ask for some guidance, find the trusted healthcare consultants. Because, yeah, I know over the years, we've had so many questions come in from a
Yeah.
variety of people asking for, can I do this? This is a new product. This is a new service I'm thinking about. Can I do it? Right. And we've had many a client who've actually reached out for that type of help. So, it's imperative in 2024, things have gotten more scrutinous. Everything is highly, highly looked at.
Yeah.
So, yeah.
Yeah. And then the last one really, again, I was like, oh, come on, seriously. You guys really should be knowing, but this is wrong on a couple different levels. From the, I don't know, notal or nodal
Notal,
vision. I don't,
notal. I have no idea.
yeah.
They agreed to pay $100,000 for allegedly violating the CMP law again by paying remuneration in the form of waived co-payments. So again, they're not letting their patients pay any co-payments. So again, free, right? Waived co-payments. And they did that routinely. And like you were hinting at, that's kind of shocking because this has been in the news for so long, so many years, that it's a complete no-no to waive copays. That patient has to pay whatever their copay is at the time of service. So they did that apparently again and again and again and self-disclosed. And so that's why they agreed to pay that 100 grand.
Yeah.
So yeah, that's
Yeah.
shocking.
And it's, and I think it's with you and I, some of it is that because we have been, in the field, for the number of years that we've been in,
Mhm.
that, we see some of these things and immediately we're just like, nope, can't do it. I mean, it's just like no, no, no.
Yeah.
But for
Yeah.
other people, it's like, well, that sounds good. And I don't see why we can't. And I'm sure, they were thinking this is going to help our patients. And, it wasn't like they probably weren't thinking of it as enticement.
Yeah,
But if you
probably.
think about it, and Medicare has put stuff out about this forever about not waiving co-pays or co-insurances,
Right.
And with commercial payors, I mean, this was Medicare that they were specifically talking about with that, the last one, the waiving. But with a commercial payor, when you look at the contracts, if you're waiving those copays, you're violating the contracts that you have. So they can end up not paying you for the entire service because you didn't take the copayment. They can come back and say, well, your service really isn't $100 because you're waiving that $20 copay every time. So it's actually only $80. So I should only be paying on that. Not only, I mean, there's just a whole mess of things, right? That could come out
Absolutely.
of that. So
Absolutely.
you have to be careful with that stuff. A lot of practices, I think, are thinking they're doing something good and doing something beneficial, not necessarily just to them. I think they're really not just thinking of them. They are thinking about what can I do for my patients and what can I
That's
do
right.
for this. And
Mhm.
but that's not the right way to go about it. You can't be doing that stuff anymore. So make sure, you're taking a look at internally what y'all are doing in your practices. And if any of the things that we talked about today seem to kind of hit home, call somebody.
Yeah,
Just
please.
check it out.
Yeah.
Look at the advisory opinions. Look at some
Mhm.
of these self-disclosures. Look at the DOJ thing to look at people that have gotten into bigger trouble where they
Right.
didn't disclose and somebody caught them doing something.
Mhm.
Take a look at some of that stuff. As I said before, it could shut down your practice.
Yeah.
And nobody wants that, especially if you're doing a good service for your community and treating your patients and all that kind of stuff. These practices are employing other people in the community. I mean, just think of that too. So, but you have to do things in the right way, because everything is being super scrutinized. What we do in the healthcare field, I know every field gets looked at by their own certifying bodies and
Mhm.
whatever, but in healthcare, because there unfortunately has been, such large fraud things that have gone on in different areas that, they really have, I mean, it's so big for CMS that they outsource it to the racks, and they have the UPICs and they have the ZPICs and they have, I mean, all the alphabet soup. Everybody's looking at your stuff. Everybody's looking for something, and they're trying to nab the bad guys. And sometimes everybody can get caught up in that. So if you're doing something and not meaning really any, fraudulent intent by it, it still could, hit home with you if you're doing something that you probably shouldn't have been doing. So, check the stuff out. Any parting advice from you on that matter, Sonal?
Yeah, no, I agree. The Medicare trust fund is depleting, which again is why the monies are at risk, right? Which is why all of these various departments, all of these contractors are out and about, right? Trying to poke around and see what you guys are doing. And they are, some of them are even incentivized to, collect, to try and make sure that they find things that are wrong. And so then folks like my good friend and I have to go in and poke around and make sure when we do our audits, is this actually accurate? Or we say, no, this is a great service. It's been well documented and supported, right? And that's how we can help our providers appeal. Because their contractors can be wrong. Not everybody is perfect, right? So I really do think that these types of self-disclosures are a good starting point as well for a practice to just take a look and see what is a practice self-disclosing for, right? I think because we've been around the block for a minute, this copay one kind of gave us pause, like, wow, we should all know better, right? Yes, we
Yeah.
want to give our patients a break. We understand financial times are difficult for people. I get it. But unfortunately, they do. Your patients do have to pay that copay or that coinsurance. They simply must. And in terms of any of these other types of really funky, unusual arrangements you think you can make, you really need to talk to a healthcare attorney to see if you can be, saved in a safe harbor type of situation, so you're not going to be triggering the anti-kickback statute, because our physicians and practice managers, all those types of folks are super smart and clever, and they think of different things that maybe they want to start doing, right? People are creative, but unfortunately, this is healthcare. And so you have to really look at that creativity with the advice of a trusted healthcare attorney or consultant, a team of people who can make sure that you're not actually going to be triggering any of these 5 fraud, waste, and abuse laws. And I think everything that you and I have been talking about over these months in Compliance Capers is really a good place for practices to take a listen to, and just hear all of the variety of things that we've touched upon that can help a practice. Like, oh, okay, they've actually talked about myself in dermatology or in ophthalmology or whatever practice it is, right? These are really good steps that you can take just to get your feet wet into the introduction of, making sure that proactive compliance that you and I love to stress here is a must, because you really don't want to be on that OIG and DOJ enforcement action list that they publish all the time, every week, every 2 weeks, at the end of the month. It's a never-ending list of enforcement actions where providers, practices, entities have been caught doing something bad. So yeah, I hope our audience today got their hands around another 4 self-disclosures here that you pulled for this week's episode, because I think they're really, really useful to our practitioners across the country.
I hope so. So we hope y'all are, getting these and these are hitting with you to, check stuff out. So we want to thank y'all for, spending some time with us on this Friday. Friday is always the best day, right?
Friday. It is.
And our last Compliance Capers for the month of April will be next Friday, of course, at 10 a.m. Central, 11 a.m. Eastern. And we'll be going over one more self-disclosure. And this is the big one that was out, and I posted on this, and I think Sonal, you did too. A lot of us did on Penn State. So they were self-disclosed and paid, I believe, over $17 million back. So that will be our last one of this month to close out our self-disclosures. So we hope y'all can join us for that one. And so until next week, enjoy your weekend. Then we'll see y'all on the next Compliance Capers. Bye.
Bye, everybody. Thanks so much.